we're going to talk about how to give an intramuscular injection of ACTH in an infant. ACTH is a steroid hormone therapy that is given as a first-line drug of choice in infantile spasms and other types of seizures. It comes in a gel form in a vial like this. We're going to go over some of the things that we're going to need for injection. I'm sure your doctor or nurse has prescribed everything that's in here, but we're going to go over it real quick. What we're going to need is a 1 ml syringe. Then we're going to need two different types of needles. One is the 20 gauge needle and the other is a 25 gauge needle. The 20 gauge needle is the larger one in size that we're going to use to draw up the medication just because it's easier to draw it up in a 20. And the 25 gauge needle is what we're going to need to inject the medication into the muscle. What we're going to need is 2 alcohol pads. One is to clean the tip of the vial for 30 seconds before we draw up the medication. Then the other pad is going to be used to clean the site of injection. We're going to need a canister to dispose of our syringes and needles, and we're going to need a 2x2 gauze as well as paper tape. Now, I don't like to use band-aids on my daughter's skin just because I find the paper tape to be more forgiving, especially since we're going to be giving multiple injections over the course of probably a month. Alright, now that we've gone over this, we're going to start with how to draw up the medication. So we're going to have to take it out about 15 minutes before the injection from the fridge. Another way to warm it up is to roll it between the palm of your hands or put this under your arm. Once this has been warmed up, we're going to start by cleaning the tip of the vial with an alcohol prep pad like this. And we're going to do this for 30 seconds. Alright, now we're going to wait until this dries while we get our needle set up. We're going to start with the 20 gauge needle, which we're going to use to draw up the medication. Twist this on. Alright, perfect. Now when you start in the beginning, when you need to start drawing up the medication from the vial, you're going to have to pull in some air, the amount of air that you need that you're going to pull up in the medication. This is because this is a vacuum canister, and so we're going to have to put in some air to draw out the medication. But since I've already used the vial many times, it has enough air, so I don't need to draw up the air like I had to in the beginning. Now we're going to go in the vial like this. This would be safer if you put it down and draw it up like this, but for the sake of the video, I'm going to go in like this. You're going to push in the air and flip the vial over. Take the needle to the very tip of the vial and then draw up the amount that you need. It's going to come in slowly just because it is in gel form, but you're just going to have to be patient and draw it up. If there are any bubbles, just tap the needle. Alright. Once you've drawn the medication up that you need, flip it back over and pull it out. Recap the needle by placing the cap on the counter and putting in the needle like so. Once we've drawn up the medication and the vial, we're going to place this back into the refrigerator, and we're going to take the 25 gauge and we're going to screw this on. So what we're going to do is going to unscrew this, place this into the sharps container, and we're going to twist this back on. Perfect. And now we're going to prime it. Basically is bringing the medication up on the needle. We're going to have to first expose the area. We're going to go into the thigh. Remember to alternate between the two thighs as well as the area. We want to go in a circular motion or up and down. Try to keep a distance between the two when you go back and forth. And first we have to figure out where we want to inject. Now we're going to go 2 finger breadths above the kneecap and 2 below the hip joint. And this area will be where we're going to go for the injection. Now, we can feel the muscle that runs along the thigh. This is called the vastus lateralis. And we're going to go into the muscle and the thickest part of the muscle. Now, I'll choose a site. I've done pretty much everywhere. So we're going to go in right here. And I'm going to get my alcohol pad. And we're going to go and clean the area in small circular motion. Like this. Perfect. And we're going to get our needle. Now we're going to have to wait until the alcohol dries because it's going to sting if you try to go in while the alcohol is wet. All right, uncap the needle. And I like to flex the leg just a little bit before I go in. I feel like she feels the sting a little bit less. Now we're not going to stab. We're going to go in slow and gently, and we're going to go in at a 90-degree angle to the muscle. Okay? Here we go. Inject in all the medication. You don't have to go all the way in. Just leave a little bit. Leave it there for a few seconds. Make sure all the medication is in. Pull out and relax the muscle and pull out in a single straight line. Perfect. Don't recap the needle, directly place into the sharps container. Get our gauze, and we are going to place it over here. Gently rub the area, and you're done. I hope you found this video helpful. If you have any questions, just leave them in the comment below. If you want to know anything else, any other videos that you would like me to show you, just let me know in the comments below, and I'll be sure to get back to you on that. Thank you for watching.